The number of confirmed cases of that coronavirus continuing to rise in the United States, now up to 5. California, Oregon, Arizona, Illinois among the states with the coronavirus patients.
We do know the immediate risk to Iowans is low, according to the Iowa Department of Public Health. However, steps are in place at the University of Iowa hospitals and clinics should someone become sick.
With that in mind, let's go live right now. That's where we're going to find KWW reporter Ashley Neighbor after talking with an associate professor of infectious diseases for us earlier today. She's live with more on what's going on in Iowa City concerning coronavirus.
Well, that's right, Abby and Ron. Like many hospitals across the country, protocols are getting put into place should an Iowan come down with the coronavirus. Now, University of Iowa Hospital and Clinics is one of the many hospitals trained to contain a contagious outbreak like this. As a new version of the coronavirus is spreading throughout the world, doctors at the University of Iowa Hospital and Clinics are preparing should an Iowan show symptoms.
Fortunately, as of this moment, there is no evidence of person-to-person transmission of this novel coronavirus in the United States. But while we monitor how things are evolving globally and domestically, hospitals need to be prepared.
The CDC is urging healthcare professionals to be on the lookout for those who've recently traveled to Wuhan, China, the epicenter of the virus.
The 5 cases reported as of this minute in the United States had all been in Wuhan City.
Staff at UIHC have been preparing for something like this for years and are now screening incoming patients.
The screen is prompted in the electronic health record to the person doing the checking in. They ask patients whether they've traveled, where they have been, over what period of time, and if they have any symptoms.
Any possible cases would be isolated in a specialized unit and tested with the Iowa Department of Public Health. But for now, that risk remains low.
You are not at risk currently in the United States. If you're here and you have not been in Wuhan City, you develop upper respiratory symptoms, it is going to be due to a more regular infection, either a common cold or influenza.
Dr. Salinas tells me of the cases found in the United States, they seem to be more mild, not requiring an intensive care unit. Now, both the CDC and Iowa Department of Public Health are urging people to take similar precautions as they would from protecting themselves from the flu. Live in Iowa City, Ashley Neighbor, News 7 KWWL.
Ashley, thank you. The University of Iowa has also issued a memo to students and faculty.
That's right, Abby. In fact, basically they're saying that anyone who recently traveled to that area of China, particularly the Wuhan, China area, and are showing any symptoms, please call their nurse line.